Welcome to Men's Anonymous, the podcast where men can be vulnerable and open without fear of judgment. Your host, Daniel Weinberg, leads authentic and unfiltered discussions that explore the challenges and triumphs of modern manhood. Join us as we break down barriers, challenge stereotypes, and redefine masculinity. Men's Anonymous, a safe space for men to lower their shields and share their inner world without judgment.
Hi, on this week's show, I've got Dr. Blecher, a qualified urologist and andrologist specializing in all things men's health. Men's Anonymous. Hey, Dr. Blecher, welcome to the show.
Daniel, thank you.
Where are you in the world right now?
I'm in Melbourne. Australia.
Nice. Yep. And you've been a doctor for how long?
I graduated 2004.
So 20 plus years. And when you get into the field that you're in, which we're going to talk about, so you've been doing that for 20 years, or you're a general practitioner and then you transition into specialization?
I graduated from medical school 2004, and then it's years of training, usually in a hospital-based system, and eventually get onto a program. So I'm a urologist, so I got into a urology training program, and I was about 6 years. And then some people take some time out after that and do fellowship, which is sort of additional training. So I did another 3 years of training over in the UK after. Okay. So went over with my family and came back with a slightly bigger family, and we came back to Melbourne 2018. So I've been practicing in Melbourne since then, yeah.
So when you do a fellowship like in the UK, is that when you're getting even more specialized in a particular area, or the general?
Correct.
Right. And when I read about your profile, why I wanted to bring you on the show was you focus on an area which is urology and andrology, and we'll go into what that all means. But effectively, it's covering men's, what would you call anatomy health, genital health, sexual health. How do you?
All of the above. Yeah, absolutely. Yep.
And so when I was looking at the area, there was a whole lot of, let's say, categories or issues that I'd never really heard of. Mm-hmm. I have very open relationships with a lot of male friends all over the world. I've never, ever heard them raise any of these subject areas as something of concern. And I think
that's a good thing, right? Like, you don't want to have to see me, right?
No, I know, but what I think is happening is that men are not really aware of things that they should be aware of, and know that once they're aware of those issues, what they can do and who they can see and what's up.
Yeah.
So andrology. So my understanding of andrology when I read it was it's the male version of a gynecologist in a way. Is that how would you say?
Yeah, look, I think, a urologist is a surgeon, and we deal with all of the urine side of things, males and females, right? Anything to do with urine. So kidneys, ureters, bladders, prostates, urethras. But then in addition to that, we also deal with the male reproductive side of things. So urologists will deal with penises and testicles and so on. An andrologist specifically, at least where I did my subspecialty training in the UK, really refers to the urologist who subspecializes in certain male genital-related surgeries. So we cover aspects like erectile difficulties or penile issues and penile cancers and those sorts of areas, I guess. In Australia, it's a slightly different term. An andrologist is often an endocrinologist, a doctor who deals with hormones and testosterone and that sort of stuff. As far as I go, basically, I'm a men's health urologist, and I deal with men's businesses that require generally surgery to help. And
when we were trying to schedule the show here today, I noticed that you have a very, very busy schedule. Like your days are blocked out like for the next, 4 to 6 weeks. I can't remember how far out we were looking, which tells me that there are a lot of males who have these issues. So when we talk about percentages of the male population. That's why I was very taken aback, because I don't know anyone or heard of these issues yet.
Yeah.
It
Look,
appears
I mean,
there is
you may or may not be surprised. Yeah, look, it's the issues that I deal with are really common, but I think you're probably right in that not everyone necessarily talks about it when you go out and have a drink. I mean, erectile dysfunction, for example, is hugely common. And as men get older,
why don't you explain what that means?
So erectile dysfunction is essentially, when your penis doesn't get hard enough for long enough for satisfactory sex, in a colloquial way of talking about it. So, it's very common. I mean, 30, 40%.
Is that something that develops later on, or do you see an 18-year-old?
There are two kind of camps of ED in terms of who presents. There's younger guys, and that's generally going to be, a performance anxiety related ED, which is very common. Now, when you're 18 or 19 and you've had a couple of interactions and they haven't gone well, you're not usually talking about it to your mates at that stage. You don't have a good network around you, don't have the confidence, you don't have the experience. And the first instinct is to go, well, there must be something wrong, right? My testosterone's got to be low is a very common sort of thought. Right. But the reality is that erections really require everything to be perfect. Okay. Yes, of course, you need testosterone. You need good blood vessels. You need good nerves. The anatomy has to be right. But you also have to be good here, right? It has to be, you have to have the candles. You have to have one glass of wine, not two. You don't want to be, intoxicated, tired, stressed, or too nervous is probably the most common thing when you're a younger guy, right? And it's very common, you just can't get it up. And there are treatments for that, which...
So for example, for where something that is a bit more related to anxiety.
Yep. It's going to be a combination of using medical therapies like Viagra-type medications, but also with psychosexual counseling. That is, a psychologist who are trained to work with people in the realm of relationships and sex and performance anxiety. Erectile difficulties is one of the very, common topics that I'm sure they'd be talking to clients about. And then the other camp of men is really those guys who develop erectile difficulties for other reasons.
For example?
Well, diabetes would probably be one of the more common ones. People have pelvic surgery, like prostate cancer treatment surgery. People who have got poor blood vessel, flow into their hearts, for example. These men may develop, heart attacks, for example, and need stents in their coronary vessels or bypass surgery. But the same process that narrows arteries, which is atherosclerosis, that's sort of like building up plaque and material on the inside of these blood vessels so that the internal diameter becomes narrow. There's not enough fuel that gets to the engine. And similarly, if the engine is the heart, the engine can also be the penis. There's not enough fuel getting down there. Same process, not enough blood, you're not going to get great erections. So that's an arterial-based or a vascular-based reason.
So you do surgery for that, or is it just a Cialis Viagra solution?
Well, the solutions to any form of ED, apart from the one that we were talking about earlier, performance anxiety, there's a handful of different treatments available, and more or less they're fairly general. They're not specific for each one. It's not like if you've got arterial-based erectile difficulties, you take this tablet, and if you've got nerve-related ED, you take that tablet. What is common to all of them, though, is the sense that, well, hang on, if this is part of aging, and sometimes our erections just get weaker as we get older, but if there's an underlying medical reason, for example, poor blood vessels, well, then that's our opportunity to go, well, hang on a second. We're not just going to treat the ED, right? We've got to take a step back, right? We're getting towards our 50s now. We need to look after our bodies. So the question is, are you smoking, right? Massive risk factor for all of ED, right? We've got to take a U-turn on smoking. We've got to take a U-turn on, well, what's your body weight actually like? Are you lean or are you overweight? And huge numbers of us are overweight. Do you have diabetes? Do you have borderline diabetes? All of these aspects need to be addressed, and that's regardless of what kind of erectile difficulties you have, because they all feed into each other.
So basically the erectile dysfunction is more symptomatic of other critical, like core issues that you have, and that's
Yeah,
all.
it certainly can be.
That's really
100%.
the side effect.
Yeah, it wouldn't be uncommon for me to refer a guy who's come in to talk to me about ED to a cardiologist to get evaluated and make sure that their heart's okay. So there's definitely an interplay between them for sure.
When the male patients come forward, is your experience that they come to you when it, like how comfortable are they talking to you about it? How quickly will they respond? Do they like leave it for a while and say, man, it's been 6 months now and I'm desperate?
Look, people come in
the
at
general
different
experience
points. But I think many men are anxious or nervous. They've never spoken to anyone about it. They may not have spoken to a doctor. They may have mentioned it to their family doctor, maybe, But one of the privileges of my work, Daniel, is that I give you a warm handshake and a smile, and you come into my office, and there's a very brief moment of chit-chat. But very quickly, I'm going to be asking you some really personal questions, and that's okay, and that's why you're here, and that's why I'm here. And we've got something to sort out, and that's okay. And I think very quickly people sort of relax into it, and it's just honest-based conversations as to what we're having so that we can try and improve it. And most of the time people walk out a lot more relaxed than when they walked in. But there's also varieties, different kind of guys. A lot of the time older guys, who've been around medical system, they know medical issues, they've spoken to doctors. For them, it's just another issue. But I think you're right. A large number of people are understandably nervous, and sometimes it takes people a long time to come and see a doctor for this. This problem, which is a shame, right? Because, ED is one of those issues that it can really churn you up. It affects, it's not just you've got an erection problem, it affects how you feel about yourself. I mean, we're on a men's related podcast, and part of feeling a man is waking up in the morning or in the middle of the night just having an erection. That's a very manly thing that we don't even think about. But when you lose that, it takes away a sense of maleness. And similarly, being able to
audience, maybe an indication of when they could, when is that the years of, let's say, the normal distribution of the time where you start losing that erection? When can men expect that to start happening in their lives?
I think on average, probably around, in their 50s and 60s would be the main sort of, group. It's going to become more common as you get older. So there'll be a larger percentage of men in their 70s and 80s who suffer from ED for sure. But the larger sort of cohort who I think get affected by it and want to manage it are going to start presenting in their 50s and 60s. It's around the same time when men are presenting with heart troubles.
Right. Right. So it's all related, really. Correct. So, but at the same time, it is quite normal that a man over his lifetime is going to, like, when you say erectile dysfunction, is it a dysfunction if it's the normal evolution of what's going to happen to you in your life?
Well, it's a dysfunction as in you're losing a function that you used to have, right? And whether it's entirely normal or not. And some men are very relaxed about it. It's not a big deal, There are some men who put the proverbial, boots on the hook, and they're fine with it. Sex for them is not a big deal, right? But there's also a lot of men out there who they love sex, and they always have loved sex, and they want to continue to enjoy sex. Then you bring in, partners. How does partners feel? Sometimes partners are very sexually active, and sometimes partners lose interest, whether it's age or age-related issues or medical issues, or just how they feel about sex. So every couple or every person is just going to be very different and individualized. And, we have to acknowledge that everyone's going to have a different path. But if a man wants to have an erection, I think it's our right. It's a wonderful aspect of being a man that we enjoy and we are allowed to enjoy, even if we're older.
Is there any risk, like I'm thinking about, do you ever get 85, 90-year-old men coming in saying, I want you to still help me with my erection situation?
Yeah. Yep.
Still having a go.
Yeah. The percentage is lower in the 90s for sure, and mid to late 80s, much lower, but we get them. And so it's their right. I mean, one of the world's simplest and best pleasures. You can't be ageist and say, well, you're too old. I mean, that's Similarly, I wouldn't say, to a guy in his 20s, if he had little interest in sex, well, fine. You're not going to say, well, you must have an interest in sex. And conversely, for the older man, you're not going to say, well, you're not allowed to. No way.
Absolutely. Okay, I want to go through a couple of areas which I read about, which so there you deal with fertility.
Yep.
I'm assuming that the way it would go here is, man's with a partner, they want to have kids, married or not married, irrelevant, and they're not able to conceive. So he will come to you and say, hey, can you check whether I'm the issue? Is that something like how it goes?
Yeah, look, along those lines, usually most people will go to their family doctors, or they'll go to, you got to quit that sugar, Daniel, I'm telling you.
No sugar. It's zero.
Huh?
It was
zero.
It was zero. But I got this as well. The water.
Well, I can't see that. Oh, some water. Okay, great. Yeah. It was flicking in and out of visual. So yeah, or they'll come from a gynecologist. So if you've seen the couple, because most of the time, if there's a fertility problem, the automatic sort of thought is, well, it's a female problem, right? But that's the biggest, misnomer of it all. 30% of the time, it might be a female-related problem. 30% of the time, it might be a male partner-related issue. And 30% of the time, it's going to be a combined issue. It'll be male and female, So for some reason, we've been brought up to believe that guys can't be infertile, or that it's super rare. And it's not super rare. Many men have a level of lower sperm count than what they may expect. And there's also a smaller percentage of men who actually produce no sperm at all.
Right.
So
there's no way to reverse. There's no way to reverse that for someone who's got low infertility or zero infertility.
Well, no, that's not entirely. No, if you've got the man with low sperm count or quality, that might be for a variety of reasons, and so we have to interrogate that. The main reversible causes are probably a varicocele. A varicocele is like a varicose vein, but instead of it being sort of down on the leg, it happens to be in the scrotum, and it ends up being this extra layer of blood vessels which surround the testicle and keep the testicle a bit warmer than it should. The breakdown metabolites within the bloodstream don't seem to get washed away as easily, and we don't truly exactly understand how a varicocele can affect the sperm production, but we know it definitely does.
So you do the same sort of procedure, you remove the varicose veins from the scrotum.
Yeah. There's a variety of treatments, but you're essentially trying to get rid of those varicose veins from the scrotum, and that can often improve sperm quality production.
Right. Is that the only benefit of removing them? Like, is there any other reason why you'd...
Yeah, they can be uncomfortable too. So occasionally you'll get some guys coming in and they say, I've got this ache in the side of my scrotum. I noticed this sort of, they call it a bag of worms. It feels like a bag of worms. That's the best way to describe it. These sort of ropey, warm blood vessels that are veins surrounding the testicle. And they can be uncomfortable for some guys. They're not usually causing pain, but they cause a heaviness, a dragging, discomfort sensation. It's usually worse sort of with exercise, lifting, standing, worse at the end of the day. And it's just uncomfortable. And
that's how they would know. You couldn't visually see, I've got some extra pain.
You can sometimes see.
You can.
If they're big enough, you'll see them for sure.
Wow.
Like varicose veins in a leg, right? Sometimes when they're big, they can pop out. You can see them through the skin. Same sort of thing in the scrotum. So that's a varicocele. And yeah, they can either present with discomfort, or they can be related to men with subfertility. And, you'd see them, they're super common. I mean, a varicocele is present in, 30-40% of the male population. It's not a rare problem.
Wow.
Out of that number, most aren't either causing discomfort or most are not causing fertility issues. But it's those guys who have those two issues that I will end up seeing and having a discussion about how to treat it.
But otherwise, there's no danger or risk in having... Okay, I want to ask you about, we talked about erectile dysfunction. When you do, I understand there are things like you can have inflatable penile prosthesis implantation, or penile implants, penile injection therapy. Explain a little bit about
Okay,
Why
so
would,
back
why would
onto
one get
ED.
implants?
We'll have to round back because we didn't speak about the guys with no sperm, but we'll come back to it. So for ED treatments, there's a variety. You know, there's tablets. So Cialis or Viagra are the most commonly known sort of brand names of those, but there's a few available worldwide.
And do they act differently? Like what's
slightly? They have slightly different ways of how they act, but they're all the same class of drug. They all open up blood vessels.
Okay.
So when you open up blood vessels, it's down in the pelvis, but it also opens up blood vessels in the face. So you'll get a headache sometimes, you'll get a red face sometimes.
Right.
They're pretty reliable, they're easy, they're relatively inexpensive, and they're convenient, right? You just half an hour, 45 minutes before, and it's available. So there's tablets. There's a device called shockwave lithotripsy, which was actually started by Israelis, very innovative in the field of sexual dysfunction, the Israelis are. And we don't know 100% how it works, but the thought is that it actually promotes new blood vessel formation in the penis. So it's been studied mainly in men who have poor blood vessel flow into their penis, but it also has been looked at in other men, diabetic men, men who've had prostate surgery for prostate cancers, and it does help improve the erectile function to a degree. Some men might look at an alternative like a vacuum pump. It's a cylinder. It's a plastic cylinder with a pump, and that creates suction or vacuum. The penis gets filled with blood, and then that can often be used with a penile ring or a cock ring, just a rubber band that holds the blood into the base of the penis. And look, most guys don't love these. You know, they're a bit clunky. They're not very sexy. There's not a lot of, hidden type spontaneity to it. And it can also be uncomfortable to use. But there's a small number of men, maybe 10 to 15% of guys who I'll see and discuss it with, and they like it and they use it. And, you can use it with a Viagra or without, and that's good for them. The next level would be using small needle injections to basically administer a Viagra type medication, but into the penile shaft.
Oh, wow.
And your eyes just then, that's the same as all my patients, right? Like, woof. But the reality is it's actually very straightforward. It's very easy. And if you're getting to this stage, right, where you're needing pumps or rings or tablets or this or that, it's stressful, right? Because sex is supposed to be one of those things that you just roll over and you look at someone and you touch and you kiss and then it happens, right? Not this, hang on a second, I got to follow a recipe of this and it may or may not work, and all the anxiety that comes along with that.
Absolutely.
So, when things aren't quite working easily, we need to find something that is going to work and be more definitive. And the injections can be much more reliable when the tablets and other treatments aren't really working that well. So it's like a Viagra. When you want to get an erection, you've got to put a little needle in. It's very straightforward, and most guys, once they get the hang of it, a lot of guys are happy with it, but not everybody. And that really brings you to the ultimate treatment, which is a penile implant. It's a prosthetic device, and there are two main kinds, but the one that most guys will prefer and go for is a inflatable device. So it has a little pump, it's all under the skin. No one can see anything, but this pump sits in the scrotum. And when a man wants to have an erection, he pumps that several times. And there are two cylinders that sit inside the penile shaft. Because I don't know if you know, but the penis actually has two cylinders in it which can fill with blood and then have less blood in them.
Okay.
So when you get an erection, you're getting extra blood flow in, the veins block off, and then you get a rigid penis. So what we do with an implant is we slide these balloon-type cylinders into the natural erectile mechanism that I just described to you there.
Like a stent.
Yeah, like a stent, more like a balloon, because a stent will have two open ends. But it's closed. It's a closed system, and it's got a little reservoir for all this fluid, for saline, that sits in the pelvis. So
how long can you have that inside your body?
You can have it in forever. They generally will last about 10 years or so, roughly, because they're made of polyurethane or silicon. So eventually you'll get a tiny little tear somewhere or a hole, and then all the fluid leaks out and it won't work. So it needs to be replaced. But they're very reliable. They're very easy to put in, and most men, let alone even family doctors, GPs, have never heard of such devices.
So how often are you implanting that in a man's penis in Australia?
Well, it depends. It depends
How
where
many
you
a year
are.
would you do?
Yeah, we'd probably, in my clinic, all up, would probably put in about 100 or so a year.
Wow.
Yeah. So
amazing.
me and my colleague,
Never heard of
is a very high volume implanter,
Wow.
and it's great because all of a sudden you literally turn someone who's got unreliable erections into someone who's got this reliable
Life-changing.
penis. Yeah.
Wow, I've never heard of that. That's wild. That's what you call the inflatable penile prosthesis implantation.
Yep.
Okay.
Exactly. Yep.
Genital
The other kind, just briefly, was like instead of it being inflatable, it's not inflatable. It's just, we call it malleable or semi-rigid, and they're just two sort of bendable rods, but the penis is always erect. So it's really good for people who, particularly, for example, in Australia, who live in the country, who are far away, they're very remote. They don't mind having a penis that's erect all the time. They might be farmers or whatever, and they don't want to have any problems with their device, because for them to come into Melbourne or one of the big cities is a big deal. So it's a very simple device which will work with, that's unlikely to break or have problems with it.
But wait, but they're erect all the time.
All the time. Yeah, you just have to bend it and sort of stays down in the underpants a little bit more. It's not as easily hidden. So most guys won't go for that as an option for that reason.
Wouldn't that be painful after a while, having your penis erect?
No.
no. Genital reconstruction.
Yeah.
What's behind men?
So there's a few things there. But so, for example, I do a little bit of plastic surgery in the genital region. So say, for example, someone has a circumcision that has scarred badly, or there's a problem with it. Sometimes people can get problems with swelling. Everyone's heard of elephantitis, which is like when there's a lot of swelling down in certain areas, it's called lymphedema. That can happen in the genitals. So I can help with that. And I also do gender-related surgeries. So it's reconstructive surgery for trans folk.
Right.
That's another sort of area that I work in specifically. Not all reconstructive urologists will do that, but I do. Yeah.
Okay. Peyronie's disease.
Yeah.
What is Peyronie's disease?
Peyronie's disease is essentially curvature of the penis. And again, it's a relatively common problem that's not really widely spoken about. It affects probably about maybe somewhere between 3 and 6% of the male population.
It's a lot.
So, yeah, it's a lot. And what happens is, we spoke earlier on about the erectile mechanism being these two cylinders, and Peyronie's disease is a scar which forms, and we don't really know why it forms. It may, in some men, be related directly to some trauma. For example, having sex and it got a little bit bent, or there was a little injury at the time.
Sure.
And then this scar forms. And the problem with scar is that it's not elastic, and the penis is an elastic organ. It wants to stretch in all directions to be what it needs to be. And if it cannot stretch, it can cause problems.
Oh, so I feel like it's tearing, basically. There will be pain.
Not tearing, just not stretching. So, if you imagine when a man gets an erection, the whole thing will stretch out.
Yes.
But if at one point it's not going to be allowed to stretch out fully, it'll stretch out, one side will stop and the other side will continue, and you'll get a curve.
Ooh, right. And
that curve can be mild, it can be 5 or 10 degrees, but uncommonly it can be really severe. It can go beyond 90 degrees. It can go to my sort of record, I guess, would be about 130.
Oh my God.
So it's U-shaped, but not being 180, but it's U-shaped,
Wow.
And that causes obviously big problems in terms of sexual function. And because that scar doesn't allow the penis to expand widthways either, I was mentioning earlier about veins blocking off for good erections, right? You need all the blood to stay in the penis. If it just drains out, you're going to lose it. And there's a mechanism in place that blocks off the veins. But if your penis can't stretch, it won't block off those veins. So Peyronie's can not only cause curvature, but can also cause erectile dysfunction.
Oh, well.
And it can cause a lack of length as well, because your penis is trying to stretch out, but it's just not stretching out like it used to. So it's a pretty devastating disease, actually, that we deal with a lot of. Because
how do you know when you've got it?
The early stages of Peyronie's are characterized by pain with erections. Right. Not everyone gets pain, and then changes. So you may even notice these scars in the penis. You'll feel sometimes a lump in there. A curve would probably be the most common presenting thing that people would notice.
When you say curve, like you're saying where it's going to the left or it's erecting left or right in a or
towards your face is probably the most common.
Oh, right. Oh, wow.
And less common would be away from your face.
Right.
Yeah.
So it becomes, and does it happen like through puberty or is it happen much later in life?
It's again usually towards 50s and more 60s age group that it occurs.
Oh, wow.
There are another group of guys who present at late puberty. But that's not Peyronie's disease. That's a congenital penile curvature. So as a guy is growing through puberty, if one part of the penis grows too much.
When you say one part, what does that mean, one part?
So if there's one section of the penis, if there's a section of the penis, say the top side of your penis just grows too much and the other side doesn't, develop as much, then that will cause a curvature, because to have a straight penis, all the elements need to be the same length, right? If you've ever seen a porn movie, you may notice there's actually, sorry?
I've never seen a porn movie.
Never seen a porn movie. Well, you'll have to take my word for it.
Okay, I will.
That apparently,
yes,
my friend told me.
Yeah, asking for a friend.
There's a not insignificant number of men in movies who have slightly curved penises, and there's a reason for it. Because they generally got longer penises, because part of it kept on growing when it wasn't meant to stop. It was meant to stop, but it didn't. Right? Now, obviously, that curve can be quite significant. They're not going to make it onto the movies. But the guys who've got subtle sort of 20, 30-degree banana type curves, you'll see it. Next time you go on, check it out.
All right, definitely.
So these guys will present late, in their teens, 18, 19, or early 20s. And they'll say, look, I think I've got Peyronie's disease because we've looked it up. And
because it hurts them? Is that why? Or because of the shape or because it hurts?
Or usually it will be because they've now realized that their curve is their penis is different.
Right.
Some of them will have engaged in sex, and if it's comfortable and no problems, they won't come and see me, right?
Right.
But if it's uncomfortable or there's problems, then they'll come.
Right.
So those guys are a different type of problem, but it's still a penile curvature, but it's not Peyronie's disease.
So men who've got a more curved banana-shaped penis are more at risk?
More at risk of what?
In that developing as they get older?
No. They develop the banana curve because one side's grown too much.
Oh, right.
So not all of them need, surgery to fix them. If they can engage in sex and they're happy, then there's nothing to do.
Right.
Enjoy your movies and sex. But if it's more significant, then sometimes we need to get involved. And occasionally I've operated on guys who've never even tried to engage in sex because it's a significant enough curve that I know it's going to cause problems, and they are so embarrassed by it. They're like, I'm never going to even go on a date with somebody with this. I need to have this addressed before.
Sad. It's sad.
Well, it's a problem that can cause a lot of anxiety, but
absolutely.
The good thing is that, the surgeries are pretty reliable most of the time. We get in there and all of a sudden we can make a huge difference to a young guy. It's not like they have to have major reconstructive surgery. They have reconstructive surgery to address the curve, but, they can then move forward and have that confidence and enjoy what we all want to enjoy, right?
The recovery from those sort of procedures, like how long are the recoveries where they can actually drop their pants and be comfortable with it?
Yeah, so the swelling and the bruising usually takes 2 to 3 weeks to settle down. The discomfort's not a huge feature, but they can engage in sex at about 6 weeks after the operation.
Okay, now I'm going to ask you about Do you do male continence as well?
Yeah. So most of my work for male continence is for men who've had prostate cancer and prostate cancer-related treatments.
So do you do a lot with prostate then as well?
Yeah, so those guys who've had, say, prostatectomies, removing the prostate is one of the main ways of dealing with prostate cancer. Radiotherapy would form the other major arm, and then there's also more sort of newer, slightly more experimental, but nonetheless novel agents that are coming out and being used. The downside of surgery for many men is that, at least initially, they'll have a time frame where they leak urine. Yeah. So cough, sneeze, and then just dribble out a bit of urine. Because when you're
you're wearing a special underwear or something like that, I guess?
Yeah, a lot of guys will wear a liner or a pad, maybe sometimes multiple pads per day. Just depends on the degree. But over time, with improved technologies, we've got robotic surgery. There's a lot of attention being placed on making sure that we get good outcomes for men. Maybe 5 to 10% of guys at 12 months will have significant leakage. So using more than one pad or two per 24 hours. But many guys are dry at that stage. They don't have a problem. It would only be a small minority who end up needing to come to me to say, look, this is untenable. I need to do something about it. And we've got great treatments for it. You can do a pretty simple surgery to put in a sort of a mesh sling. That's one option. And essentially that just supports the urethra. It supports the water pipe. Part of the problem after the surgery is that you lose your supports and you lose your sphincter muscle, which is important for continence. By putting in a sling, you can just readjust things and give things more support, and that'll be a great fix for many men. There's sort of adjustable slings where you can inject saline to sort of give more support. And then finally, there's what's called an artificial urinary sphincter, which is a prosthetic device, which essentially it's like a cuff. It's like a bracelet that sits around the urethra tube. The urethra is the water pipe. And this cuff is filled with saline and it squeezes constantly. And the man will have a pump that, again, is under the skin. It's all implanted. It's not visible. And when he wants to pee, he finds this pump in the scrotum, presses it a couple of times. And as he's pressing it, that's forcing fluid out of the cuff. So it allows it to relax. The urine can flow. And then there's a little balloon, again, sitting up in the pelvis, which is about the size of a lollipop. And that pressure regulates back into the device so that after a minute or so, fluid will then go back into that bracelet, that cuff, and put some pressure around the urethral tube and make them dry once again. So that's the fanciest sort of option, but it's been around for a long time. It's not a new invention.
Unbelievable. Wow.
Yeah. And that again is a life changer. We don't realize how important being able to be in control of our urine is until we don't have it anymore.
It's amazing, eh?
You want to meet your friends, you want to go to work, you want to play squash or golf, you want to have a drink at the bar, you want to leave your house. All of that is really highly dependent on an ability to be continent. And when you don't have that, some guys end up getting trapped almost in their houses. So, the kind of work that I can do to help people really transform their lives is a blessing.
Absolutely. With prostate, how often should men be having a checkup for their prostate?
It's a good question, and it probably varies depending on where you are in the world and what your urological society suggests. But I think generally now, once men hit about the age of 50, maybe once every 2 years is probably where we're leading to at the moment. If you've got some sort of an increased risk factor, so you've got a strong family history or some genetic condition that may predispose you, then you might consider having that done early, your early or mid-40s, starting at that stage.
And what symptoms should men be looking for that is going to tell them, hey, I may have something up with my prostate?
You know what? The problem with prostate cancer is that it very uncommonly will give symptoms at least early. If you're getting symptoms of, not being able to pee well and blood in your urine, most of the time, look, that could be a symptom of prostate cancer when it's quite late, but most of the time, those sorts of symptoms rushing to the toilet, going more often, peeing at night, poor stream, not emptying well, having to strain to get the urine out. These are symptoms which are related to normal aging.
Oh, right.
Right? As we get older, the prostate gets bigger.
Okay.
Right? The schmeckle gets smaller and the prostate gets bigger.
Mm.
And the issue with the prostate getting larger is that it will block the urethral tube and block the ability of the bladder to empty. So you get these symptoms.
Oh, right.
Prostate cancer generally doesn't present with symptoms. So it really does require a conversation with a family doctor and a discussion about doing a blood test. It's called a PSA test to help identify whether or not you might be at risk. And if the PSA is potentially elevated, the next usual step nowadays will be an MRI scan of the prostate. And that is not 100% perfect, but it is quite helpful in being able to either reassure some men and say, look, we don't need to take this any further, or say, look, it's a bit borderline, or actually there is something there. We need to get a biopsy. We need to find out what this is and then whether or not it needs some treatment.
When the prostate is removed because it needs to be, how does that affect your erectile function and your sexual health after that? Is it game over in that sense, or?
Well, no. I mean, that's the beauty of my work. I try and make sure it's not game over. Many men will experience a big change in their erectile function. When you have the prostate removed, you will lose ejaculation.
Right.
So when there's two little structures on the back part of the prostate called the seminal vesicles, and that's where most of the ejaculate actually comes from. So that gets removed. It doesn't mean you can't have babies because you've still got your testicles and there's still sperm in there. So in theory, you could still take some of that out and use it with assisted reproduction, IVF type technologies.
Right.
But in answer to your question, you'd probably say at least 50% of men are going to have a very significant impact on their erectile quality.
Right.
Whether it's the ability to get it, whether it's the hardness, or whether it's the duration. But that then sort of brings us back to the beginning of our conversation about those treatment options, whether it's tablets or pumps or injections or implants. These are the kind of modalities that we have to offer men.
Right.
And often
to reverse or to improve that situation.
Yeah, absolutely. Right. Absolutely. And look, some of those guys will improve over 12, 24 months after the surgery. So every now and then you'll get men who their erections aren't great to start with, but they slowly do get better. They may not get back to what they used to be like, but that's where they'll come in and have a chat to somebody like myself.
Dr. Blecher, absolutely fascinating. I think I've learned so much in this last hour of conversation, and it's really eye-opening to I think for men to understand firstly that they're not alone. Like these are a lot of these things you're talking about, you're referring to them as quite common. Like, and I think for men to know that, I think would it doesn't make the situation better, but it helps, I think, take away the anxiety of like oh my God, there's something wrong with me, where in actual fact it's a common issue that is experienced by a lot of men within within society. So I want to thank you for your time. But before we go, I ask 5 questions usually at the end of my show, and I'd like to ask you these 5 questions. Just give a quick response, whatever comes to your mind, and we'll wrap it up. Who would you like to say sorry to given the chance?
I'd like to say sorry to my parents, because now that I'm a parent, like kids are hard work, right? And you don't say sorry to your parents as a kid, so I'll say sorry now for whatever I was like back then.
What are you proud of being or doing in your life?
Oh, being a dad, for sure. That's the toughest work, but makes me super proud when I see my kids do what they do.
How many kids you got?
I got 3.
You got 3, nice. When did you receive kindness while needing it most and expecting it least?
I got some kindness from a nurse unit manager at work one day. It was over the last, it was about 18 months ago. So when all the conflict was occurring in Israel, and I'm Jewish, and there was a lot of conversation even at work about this sort of stuff, and it was tough to hear what people were saying, knowing how I feel about the situation, and that was a tough one. So I went to the nurse unit manager. I said, I just need a moment, and she was just there for me, and it was pretty emotional. So I didn't expect her to be supportive in that way, but she just needed to listen, and that was enough.
Oh, wow. That's nice. What did your mother or father teach you that you frequently remind yourself of?
My father especially, he'll say, don't sweat that small stuff. It's going to be okay. Yeah.
That's always a good one. And the final one is, what's Dr. Blecher's superpower?
Superpower.
Yeah.
We've mentioned it. I reckon my superpower is that very quickly I can have conversations with people about really intimate stuff, and it's not awkward, and it's healthy. And yeah.
Amazing. Dr. Blecher, thank you so much for your time.
Amazing. Thank you, Daniel. It's been good fun.
Yeah, it was great.
That's it for this episode of Men's Anonymous. Thank you for listening. For more information on the Men's Anonymous podcast, including resources discussed in the show, visit mensanonymous.com. Join us next time as host Daniel Weinberg provides a non-judgmental space for men to voice their innermost feelings and thoughts.